Hello, everyone, and welcome to Biscom's webinar, a live webinar where we're going to be discussing some of our healthcare customers. This is something that is, we've talked about a lot and we've thought about a lot, and we have some really interesting use cases for our file transfer solution. And today we're going to be talking about Mass General Hospital, Boston Children's Hospital, and Steward Healthcare. So, quick thing on just from a housekeeping perspective is we are going to, since it's a live webinar, you actually can ask questions anytime. So if you want to enter your question, please just simply go to the Q&A box and put in your question, and it'll get added to the queue. We also have people who have submitted questions ahead of time, which we'll be answering. And if you really are interested in being live and want to ask a question yourself, we can unmute you as well. And the last thing is the recording of this will be sent out to everyone, and of course those who weren't able to attend. And so what I also want to do is introduce two of my colleagues who are going to be helping me out here. John Lane, who's our CISO, and Eric Lawrence, who heads up our SFT sales. And I'll let you two introduce yourselves.
Thanks, Bill. My name is John Lane. As Bill said, I'm the CISO here at Biscom. I've been in the secure document delivery space for over 25 years now, especially working with hospitals across the country and other organizations, helping them secure that secure file transfer, whether it was fax originally, now it's SFT, that we help to customers get those connections and share those documents securely. And really my favorite part of the job is seeing the customers' sense of accomplishment when it's all done. It's really cool to see.
Great. As Bill mentioned, I'm Eric Lawrence, and I head up the sales for our Secure File Transfer division. I've been with Biscom for about 8 years. I've worked with probably most of the healthcare organizations that we have now.
Great. Okay, so first let me give you a little bit of an intro into how companies and some of our customers are using secure file transfer in healthcare. First, the thing is obviously security is super important, and but it's also just table stakes, right? So these days with HIPAA compliance, you really are required to maintain confidentiality of all patient information. But as you'd expect, everyone needs does that. But I think one aspect that's super important that people just often forget is it has to be really easy to use, and that's been one of our really big focuses is trying to understand how our products are used and how do we make it extremely simple for them to use it, for our customers to use it. And ultimately, I think obviously the key is to how do we improve patient care, and that's what our customers want to do. They want to provide the best patient experience possible. And we're really fortunate to be able to help in that. Some of the use cases the use cases in healthcare are really varied, but clearly people are sharing information about patients. They also do a lot of research collaboration. They're also managing and sending very large data sets or files. So some of the records that are being sent out can be very, very can be massive depending on how old you are and how much time you spent in the hospital. But ultimately, all of this is done to really increase responsiveness, to provide that security, and of course to maintain HIPAA compliance. And one real quick thing I have to add in here because I'm really excited is we're partnered with HP, and we just announced some of the latest integrations, which is with their MFP line. There's a new initiative there called the HIPAA Healthcare Edition portfolio, and for healthcare, and it all of our products are actually embedded in those devices. So it's even easier now to use our file transfer and our fax solutions from any MFP. So let me get started with our first customer, Mass General Hospital. Most of you probably know or have heard of Mass General. It's consistently ranked as one of the best hospitals in the world, and just has an amazing group of physicians and nurses and staff. People flock to this hospital from all over the world because of its prominence and its reputation. And this isn't, and so clearly there are just a ton of patients that they see. In fact, their HIM department uses us for release of information, the ROI process, and they do 50,000 plus requests per year. And so one of the first things that we did when we came in and worked with Mass General is we kind of try to understand their, what their process was, and it was extremely manual. So imagine, if you're a patient or an insurance company or a law firm trying to get information on some kind of procedure or part of the patient record. The HIM department would actually take that record, sometimes print it out, mail it out, burn it to a CD and overnight it, right? So there's lots of different ways they were doing it, but they're very time consuming. And so one thing that they did was when they implemented Biscom is they were able to see two very big significant advantages. First of all, it was very, very quick to actually implement and process records or requests. And so the amount of labor and time that was just a huge amount of the work was significantly reduced. And in fact, the number of people that needed to do this was significantly reduced as well. So they could redeploy those resources to other projects. The second thing that they found was the costs decreased significantly as well. Just imagine the cost of printing it out, mailing it, or FedExing it, and not to mention just the time that people spent on it, right? The hourly rates. That could all be done now significantly faster. And on top of that, they were assured about security, and they had a full audit trail. So these are some things that Mass General was able to implement with Biscom's file transfer solution. Mary, do we have some questions around Mass General?
Yes, we do. The first one actually just came in live.
Okay. Oh, by the way, I want to introduce Mary Skews. She's actually the person behind the scenes who's actually making sure all of this comes together. So she's probably got 20 windows open, ensuring that this goes smoothly. And she's also the person who's going to be moderating the questions. So thank you, Mary.
Okay, so our first question did just come in live. What boxes were required to tick in order for our solution to be HIPAA compliant, and how does our solution meet them?
So that's a great question. It's always the question that's asked, which is about HIPAA compliance. And I'm sure many of you have actually read through the law. The thing that we do to support that, there's a security rule and the privacy rule, is really ensure two things. One is making sure that all the information that we store is encrypted. So it's encrypted at rest. It's also encrypted in transit. And the second thing we do is we authenticate users. So we ensure that people who are supposed to work on this information are the ones who work on it. And all of this is tracked in our database and can be reported on. So anytime there's an audit, that's actually something really pretty easy for us to do, is provide that kind of information. So we're supporting all that HIPAA compliance that obviously everyone in healthcare needs to comply with.
So Bill, the other things that it also adds in is the MFA, right? So now the level of authentication and the compliance role that we have built in, where we have a role that you're going to sign out to one or preferably two people in your organization at most that can track what other people do. So if there's an audit, they can go in and see what happens and where a file went and how many files were sent and what the content was. But at the same time, they're also tracked. So, right, the auditor is being, the watcher is being watched in that case, which is a good practice to have.
Yeah, to expand on that, that's why we recommend having two compliance officers, two or more. And as John said, one can check up on the other and see what they're doing, so one person's not going rogue within the system.
Yeah, so Bill's always watching me is what we're saying here.
Someone has to, John.
Yeah.
Okay, our next question. Why did MGH decide to do this, and what was the trigger?
Eric, actually, do you want to talk about that?
So the question broke up.
Why did MGH decide to do this, and what was the trigger?
Oh, the main reason why they did this, as Bill mentioned, they were sending out thousands of medical records by mail, by FedEx, and that was becoming timely and costly. And with Biscom, they were able to send those records out without printing them out in minutes, less than minutes.
Yep. One other thing too, Eric, and this was an interesting piece. So you can actually, people do charge for the delivery and of these records, and they had a process around collecting credit card information, and so payment was always the, they had to get receive payment before they could do the delivery. And so there's actually a little feature in SFT. It's called a secondary password. So they could deliver the file, but then only give them the secondary password once payment was received. And so that actually, again, was one of the things that sped up the process. I think also just increased the profitability of that, what's a pretty good revenue center for MGH.
Right. And with that tracking, they were able to see when the file was opened and who opened it.
Mm-hmm.
Reports are visible by the sender as well as admin.
Right.
Okay, our next question is, how do you measure the productivity of the transition to SFT?
I always look at people involved, right? That's one thing that sometimes people forget to include is how much time do people spend on this. And in MGH's case, I think they had 4 or more people that were busy on this, and I think they were able to reduce it to about 25% of that moving forward. So that I always think about I have so many projects going on, and I'm sure MGH and every one of our customers do. How do I make sure that I can work on higher priority projects? So this for them, I think, was that was one of the biggest measures of kind of that productivity, cost savings, et cetera. So look at that. The second thing is just number of records they can process. And I'm not sure that they would necessarily be increasing the number of records. The requests are still the same, but each person, the number of records a person could process just went up, significantly, and that was, again, going back to the ability to do more with less.
Another great benefit, Bill, is the patients potentially get that records, or another clinician gets those records quicker. Right? Mm-hmm. Where if it was put on a CD and mailed, it could be days before you could even schedule maybe an appointment with the specialist. Now they can get it within minutes. Really, frankly, seconds if they're ready for it, right? But now if I'm in a doctor's office and I'm waiting for a record that didn't get transferred, I'm not sitting in the waiting room anymore, right? It's coming in and I can get in and out quicker. Maybe, kind of relieve some concerns I have about why I'm seeing that specialist.
Good point.
Okay, Eric, I know you mentioned some reports earlier, but somebody actually asked what kind of usage reports are available.
Sure. And as I mentioned, we track every action that's taken. So you can see when a file was sent, to whom, when they opened it, and all these reports are stamped with a time and date. And as I mentioned, these reports are visible by the sender. So you can go in and see what files you sent 2 years ago and see who opened them. And these reports are also visible by an admin.
Another fun reports that they actually have in there as well are some of the system reports where you can see how many deliveries were sent by the whole organization over a period of time, how many files, and that kind of stuff as well for kind of those geeks out there. They can see what's happening.
Okay, we have one more question for Mass Gen. What about complexity and resistance to change?
Yeah, not just obviously Mass General, but every customer deals with that, and I think that's again why a big part of our focus in all of our products has been just is it easy to use, is it intuitive? So UX the user experience is super important in our minds. So the good thing and what we've heard is that they were able to get up and running right away. It was extremely quick. If you can use email, you can use our product. So that required very little training, and but it's a huge deal because adoption, you can imagine people invest plenty of money into really great tools and technology. There's some really great encryption tools out there, for example, but they're really complex and hard to use. And guess what? Those tools that companies spend a lot of money on don't get used. And so if their adoption is low, it doesn't matter how good that encryption is, they're probably going to try to get around it, with a workaround that's not as secure. So you want to balance security with ease of use and make sure you have both. All right, why don't we move on to the next case study? The next one we're going to talk about and John's going to discuss, is Boston Children's Hospital.
Yeah, so Boston Children's Hospitals is right in our backyard here. It's one of the best really premier children's hospital in the whole world. In fact, in 2019 and for 6 years running, and I'm sure it'll be in 2020 as well, they're ranked as the #1 pediatric hospital in the United States. And now there's some on the screen, of course, some great numbers, but if you look at it, over 600,000 outpatient visits in a year and 28,000 surgeries. It's kind of mind-boggling numbers. And one of the biggest things they focus on really is cutting-edge medical research, right? They're doing procedures that are not only used in pediatrics, but also used in adults years ahead of everybody else. And part of that requires collaboration, right? And they need to collaborate with outside researchers, doctors, scientists, institutions, the government, of course, for approval. And with that comes lots of data, and lots of large data. Bill kind of got into it a little bit with MGH, but if you have a study with thousands of patients, hundreds of documents or pages each, that could be huge amounts of data. Additionally, they're still doing that same type of file transfer, the ad hoc, the release of information, because they do have patients and surgeries and that have to be shared with outside entities. And they were challenged before they moved to SFT with a few things. They needed, once again, that easy to use solution, right? Something that helps people do the right thing, because they have patient information they're going to share as well as research data. And they had a fairly good in-house homegrown system that served them well over time. But there were some limitations in in-house solutions. One was a 2 GB limit on transferring files. You imagine these research data is probably 10, 20 times that easily. And they were having problems having to break up those files into multiple components and then pull them back together afterwards. And we're dealing with people that are really smart, but are not IT smart and don't want to deal with that anyways. They want to help people, right? They don't want to combine files and break files apart. And they needed scalable.
I don't want to do that either, John.
Well, I'm going to still make you do that because we limit Bill's transfers to only about 100 megs. But they want to have unlimited number of files, unlimited number of users, file size, and all that. And the worst thing about an in-house solution, you got to maintain it yourself, right? You got to do the bug fixes, you got to do the security, and security with web apps isn't easy, and you have to be experienced and know what you're doing to do it. So their solution, of course, was adding SFT as a tool for large file and secure file transfers. It was immediately adopted by the users because, as Bill said, it's like using email, right? And I believe, being a CISO, that people want to do the right thing. If you make it easy for them to do the right thing, make it like email, they're going to do it. They're going to do it happily. And that's what happened at Children's. The file limit was removed. No more breaking those files up. And in fact, they could send a 100 gig file. And if there was something wrong with the transfer, the auto resume feature would kick in and then finish it up so that you didn't have to re-upload it. And kind of finally talking about the two workflows a little bit that they have in place. The first one's obvious. Bill went into it, which is that ad hoc release of information, patient information. But with the collaboration side and the research side, they need to use our workspaces. And they need to really collaborate on documents and stuff rather than just send it one time to somebody. So the workspaces features allows multiple users to connect in, which they were able to do, upload files, put comments in there, and share them. And at the same time, it's all auditable, trackable. You know who did something, you knew who uploaded, who deleted it. And that workspace feature, I like to think of as a public-facing SharePoint, right? SharePoint's a great tool, but if you want to make it public-facing, it's a little on the tough side and it's costly. It's really costly for that license. So that's the way I think of workspaces. And before we get to questions, I just want to remind you, hey, if you got a new question, submit it through the Q&A for us.
Okay, so question is, can you automate workflows?
Yeah, we can. We have customers doing it all the time. We have an electronic prescription company out in the Midwest that is part of their process is taking in secure deliveries, automatically pulling them out of them, and depositing them into the workflow. And then the outbound side, they're sending messages back to people through those secure deliveries, and they're using our APIs to do it, which helps them speed the process, right? No longer manually, someone's got to go and click a button or send a couple messages. It's going out immediately.
We also have a couple of modules. One's called Auto Post and Auto Fetch. We have, and so one example here is a pretty big life insurance company is sending applications in from all their field offices into their headquarters in Hartford and processing them. And that's all being done. So people, it's basically a touchless system where they scan it in, gets dropped into a folder, and then that anything within that folder gets delivered out securely. So one of the things that was actually really important for that was an SLA around how quickly the application was processed. So that was an interesting twist, I think, to the automation piece.
Okay, our next question is, does it work within email?
I can take this one. Yes, we do have an Outlook plugin that would allow users to send any size file right through Outlook. This can be done by policy or a send secure button. But one thing to remember, these files do not go through Exchange and are only accessible when the recipient on the other end logs in to view these files.
And being a former Exchange administrator, that's the best part of the whole thing, right? Getting those files and all that crap out of my Exchange server, right? If you think of it, about 5% of the emails are sent out with attachments, but 95% of the space taken up in email is all about those attachments. So anything to move that, get it out, is a great thing. And then put on my CISO hat, right? Getting PHI out of email and not storing in there, that's perfect. I mean, that's how I get to the HIPAA compliance and keep those security rules in place to prevent the inadvertent sharing of PHI.
Right.
And not to pick on Eric and Bill, but they were both some of our biggest attachment abusers.
Right. I'll say the best part about it, John's happy, but for the users, they're not changing their workflow. They're still using Outlook.
Yeah, that's a great point.
Yeah,
Okay.
a lot of our users, they live in Outlook, and not having to do that context switching to another application, just again, it's part of that adoption, right? So people who use our Outlook plugin are more likely to adopt the technology than those who don't.
Okay, our next question is, what does it integrate with?
Well, actually, really anything. So one of the things we did with SFT when we first built it was to implement a REST API, and so that means you have our customers have access to every single capability that's built into the system, all through REST-based API, which means it supports new applications you build, it supports scripting, it supports legacy applications. So really kind of in line with kind of what people are doing today, which is their composability is a big factor. They want modularity. So with Biscom, they can really just pick and choose what capabilities they want and embed it directly into an existing workflow or a process.
Okay, we did have a...
Oh, sorry about that. I gotta throw one more thing in, Mary. And one of my favorite examples of using the API is one of our media companies who sends over 1 million deliveries to recipients every week, sharing things like commercial information and other proprietary information. And it's done with, creating the one file, and it's out the door, and it's so fast and so easy compared to what would have to be done in the past.
Okay, we had one last question come in live. Do I need to configure anything on Exchange servers? Our department doesn't have admin rights.
So no, that stuff is all done on the front end through the Outlook web client. Outlook add-in, sorry, is where you're doing that, and you're giving them the ability to transfer that file over there based on file size. Now, it's also good to use group policy to implement some of that stuff and set those settings, but at least you can go around that if you need to.
Yep.
Because I know those Exchange server administrators, they can be a little tough. In
fact, one of the nice things is, so there can be an Exchange Outlook file size policy, and we can bypass it by supporting, there's an extra button we have a special attach icons. When you click it, it actually attaches the location of the file and uploads directly from there instead of actually having to put it through Exchange. All right, we got to move on. We're running out of time here. So we'll go to our next case study, Eric. is going to talk about Steward Healthcare.
Great, thanks, Bill. Steward Healthcare is a large for-profit healthcare system, and they've been a Biscom customer for about 10 years. Their deployment started with a specific use case for the marketing and legal departments, and it has since grown to be the ad hoc file transfer solution for the whole hospital. Through their M&A strategy, Steward has grown to over 35 hospitals, and Biscom is now, again, utilized across all departments. It is used for medical records, health insurance coders, as well as the facilities and M&A departments. Due to HIPAA and other state and local regulations, security for Steward is paramount, and Biscom was the easiest way for them to send their ad hoc files securely without their end users, again, as we mentioned today, changing their behavior or even the recipients changing their behavior. It was the easiest way to get these files out. And as with the last two, if you want to ask some questions, now would be the time to send those in.
Okay, we did have one just come in. How is an HP MFP utilized for SFT?
Okay, so we built an app that runs on the newer MFPs, and so you just essentially you have your account and you tie into it by through the app. You log in, you authenticate, and then you can deliver anything you want. So typically, you're scanning in a stack of papers, for example. You can attach it to the delivery and then send it out directly from the machine, so you don't have to go back to your desk and actually do something. Do it there. But actually, the HP, we can obviously talk a lot more about HP. The one thing I did want to mention about Steward, which was the funniest thing to me, was when I was visiting them, I said, "Hey, so you're using this for patient information, right? You're sending patient, like that must be the most important thing." It was, no, actually, it's we're sending these CAD blueprints because we're every hospital we hire, we have to rebrand it as Steward, and so a lot of the work that actually they were using us for was to send these very large blueprint files.
Okay, we had one more come in. What is required of the recipient the first time you send them a secure transfer?
Sure. For the recipient, when they receive an email notifying them that they have a secure file, that email contains a link. They would click that link. They would then create a password. Their email address would be their username. Once they create that password, a couple of things would happen. Either an email is going to be sent to that email address just to verify they are who they say they are, or they can go in and directly view that file. Typically, we see that secondary email address, typical of all web applications. And then the next time you send them a file, they'll just click the link, enter their password, and they're able to get in.
Okay, I know we're at the end of our time. We did have two more quick questions.
Let's do them. We have time.
Okay, who is the most appropriate person to initiate this within the hospital?
To initiate it, you mean like to bring it into the? If you're talking about bringing it in, often we see is it comes from the top. Usually, CIO, CFO, they're looking for ways to share information securely, and then I think typically it gets pushed down to the IT department to actually go out and find who can support this type of initiative. So while I think the C-suite is responsible or the ones that are driving it, the IT, we work very closely with the IT teams to ensure that it meets all the security requirements. Functionally it does what they need it to do, and also that the users are able to adopt it.
That's exactly correct, Bill. Usually it's somebody internally in the hospital, whether it's the HIM department or the case of Steward, it may be the facilities department. They'll go to somebody within IT, and then that will transfer over to us. We'll speak to them and then get the end users involved as well.
In the old days, the IT people would come to us because they were we've replaced a lot of FTP systems, and they were tired of spending the time to send a file over FTP for an end user. So our solution is self-service, which frees them up to do, again, higher priority projects that IT always has on their plate. All right, Mary, do we have another one? Last one?
We do have one last one. Can you customize the usage reports?
Yeah, so we have a ton of pre-canned reports that are pretty useful. User activity, we have system information, we have transactions, right? So that's all kind of built in and you can use right away. But the nice thing about our back end is it's a SQL database, and you can essentially build any kind of query you want, extract the data and use it the way you want. But I think 90% of the time our existing reports will satisfy almost everything you need, and you can export it into a CSV file, for example, and it also supports syslog. So if those are important to you, you can definitely use those two integrations. Good.
Okay,
Is that it, Mary?
I think that's it.
Okay. Well, hey, thanks for everyone. I know this is a very quick one. I find that the short webinars are often the most enjoyable for me. If you have any further questions, though, feel free to contact us. We're happy to discuss your needs, or if you already have us, if you want to do more with us and extend what you already have. But I want to thank my esteemed colleagues, John, Eric, and Mary. Thank you for putting all this together and working with us. Thank you very much.
Thank you.